Okay, so just finished the lung sounds. There were no adventitious sounds. So now I'm going to begin with the abdomen. I'm going to look at the abdomen. Upon inspection, I don't see any peristalsis. I don't see any palpations. The umbilicus is midline and inverted. Skin color is smooth and even. I don't see any big bulges or anything like that. Now I'm going to begin with auscultating the abdomen. I'm going to listen to begin in the right lower quadrant, and I'm going to listen and move up in a clockwise manner and down. And in each of those 4 quadrants, I heard vowel sounds. So vowel sounds, they were normal active, and they were present in all 4 quadrants. Now I'm going to begin with palpation. I'm going to start with light palpation, once again in the right lower quadrant, and I'm going to have the client bend his legs up for his personal comfort while I'm doing so. I'm going to start with lightly palpating, once again in that clockwise manner. I didn't feel any masses. There appeared to be no tenderness upon palpation. I didn't feel any bulges underneath. So now I'm going to go with deeper palpating, once again, all 4 quadrants. And now I'm going to also move over. There was no pain with that. I didn't feel anything else. I'm going to do the liver. I'm going to use the bimanual technique. I'm going to lift up a bit underneath the ribs. I'm going to use my other hand and kind of come underneath like this. I'm going to have him breathe in and out. And I did feel the lower border of the liver. I'm going to do the same with the spleen, with this hand over in the back, and have him breathe in and out. And I did not feel the spleen, which is normal in an adult. I'm going to now use the 2-handed technique for the kidneys, the duckbill technique. I'm going to have him breathe in and out. And I did not feel the kidney, and once again, this is normal. It may be normal to feel the right kidney in an adult because it's lower because of the spleen. I'm going to use this 2-handed technique for the other kidney as well. Good. Now I'm going to palpate, or I'm going to percuss the abdomen. I'm going to percuss in all 4 quadrants. And I heard tympanic sounds in all 4 quadrants. So now I'm going to measure the liver, and I'm going to start up here. I'm going to move down. I'm going to listen for where it turns into dullness, and I'm going to mark that area. Then I'm going to start down here in the tympanic sounds and percuss up until I hear dullness again, and I'm going to mark that line. I'm going to measure in between, and that's about 8 centimeters, which is normal in an adult. So now I'm going to look at his jugular vein up here. I'm going to begin the vascular examination, and I can see, I see a little bit of a pulsation, so I'm going to have him sit up a little bit, and he's going to pretend to be an examination chair, and I can see that it has disappeared at 45 degrees, which is normal. So now I'm going to have him sit up all the way, and I'm going to check his hands. I'm going to look at them. I'm going to inspect them. I'm going to test the capillary refill. And his capillary refill comes back in less than 1 second, which is normal for an adult. I'm going to see if I see any clubbing on each hand, and I do not see any clubbing at all. So now I'm going to palpate his pulses. So I'm going to start here with the radial pulse. I'm going to palpate in both hands. I'm going to palpate the brachial pulse. And these are equal bilaterally symmetric. For the carotid pulse, I'm only going to do one side at a time. And I'm going to come up here, and I feel that. And for each of these pulses, they're 2+. And I feel both sides of the carotid. So now I'm going to lay down and I'm going to do the femoral. And these are equal bilaterally, 2+. I'm going to have him kind of bring his legs up a little bit. I'm going to do the popliteal. This is one at a time. And I can feel this. I'm going to do the dorsalis pedis pulse on each foot. These are equal bilaterally. And then I'm going to do the posterior tib pulse. And I can feel both of these, and with both pulses in the feet, these were 2+. So now I'm going to listen. I'm going to listen to the carotid area on both sides of the neck. I do not hear any bruit. All right, I'm going to listen to his aorta. I'm going to listen to the renal arteries. I'm going to listen to the iliac and the femoral. And with all of those, none of those I heard any brewing. So now we're going to sit up and I'm going to begin the neurologic exam. So I'm going to ask if you can do rapidly alternate your hands like this on his knees, and maybe we can sit forward. Rapid alternating movement on his knees. Does not appear to have any difficulties with that. Now can you touch your nose and then touch my finger? Good. I'm going to move it up here. Good. Down here and over here. Good. No problems with that. Can you go like this with your fingers? Good. And a little faster maybe if you can. Awesome. So now I'm going to have you close your eyes and I'm going to lightly touch the light touch sensation, and you just tell me where I've touched. Good. So the light touch sensation is present in his lower extremities, in his upper extremities, and on his torso. Right? Good. Okay? And so now I'm going to do his reflexes. So I'm going to start off maybe with the biceps reflex. So I'm going to support his arm, and I'm going to hit my own thumb with my hammer. And as a biceps reflex, I'm going to come up here and do the triceps reflex. Good. And I'm going to do the brachioradialis reflex. So I'm going to hit right above the styloid process of his hands. Good. And then I'm going to do, his legs would be hanging, and I'm going to do the patellar reflex. Good. And then his knee is going to be bent, and I'm going to do hit in the back, and he's going to plantar flex his foot. So that concludes the reflexes, and for each of these things that I've done throughout this exam, I've done one side, but you would obviously do the other side for each of these things, where the eyes, ears, everything, both sides. So now I'm going to do the Romberg test. So I'm going to have the client stand up. I'm going to say, can you shut your eyes and put your hands at your side, and we're just going to make sure as he's standing, and I'm going to time this for 20 seconds. And as the client is standing here, I notice that he's able to maintain his balance. He isn't falling anyway, and he does not appear to have any limitations with that. So his eyes are open again. He did well with that. I'm going to see if the client can walk with his heel to his toe. Once again, he's doing this with no ataxia, no falling, not losing his balance in any capacity. So then can you just walk normally across? And his gait appears smooth and even, and no limitations, no uncoordinations. And that was a negative Romberg test. So now I'm going to inspect his spine. So I'm going to have him turn and kind of look at his spine. It appears to be straight. Can you bend forward for me? It still appears to be straight, and maybe can you bend back and to the sides? So he does not appear to have any limitations with his spines in that capacity. So now I'm going to look at the range of motion. So we're going to have him flex his arms up and kind of see if he can hyperextend them back, abduct them away from his body, adduct them down, across. Good. I'm going to see if he can bend at his biceps. And for each of these, now I'm going to have you kind of lift your arm up and kind of against my strength, kind of try to push down. Good. I would do the same for the left arm. Good. And so for each of these, his strength is 5 out of a score of 5. He's able to do full range of motion against resistance. I'm going to have you see if you can pull up against me. Good. And the other arm. Good. So no limitations with that. And for your wrist, can you just up, down, and kind of out to the sides, and then just your fingers up and down. Good. And spread them apart. Awesome. So now we're going to lay down, and I'm going to just do the hips and the legs. You can bring each leg up like this. Good. And back down. The other leg. Good. And back down. Then keep them straight and go up and down like this. Good. Other leg. And maybe bend your knee. And kind of, can you go out with that and in? Good. And each of these, can you pull out against my strength? Good. So that's 5 out of 5 for the leg. And other leg out and in. Good. So he has full strength in the upper extremities, full strength in the lower extremities, head and neck. And this concludes our examination. Thank you for watching.
Good job.
And thank you to my client, Barry. Oops. Okay, how do I start?